being an avid runner, putting on over 100 miles a week, running, I knew that something wasn't right when I actually I could run, but I couldn't sleep through the night anymore. My lifestyle has changed considerably, being running over 100 miles a week to now swimming and limping out of the pool, to doing step masters and step mills and limping getting off of them, and kind of being tired of asking the question, what's wrong with you at your age? I am excited to the fact that I'll come in and I'll go out, and I've already had physical therapy scheduled for that Friday after Tuesday, and it just makes sense not to be introduced into a hospital in December where there's a lot of sickness and illness.
Ed is really a perfect patient to have this done. He's young, he's very, very active. He's been through a lot of troubles with his knee. He's had a couple of surgeries. He's gone through exhaustive physical therapy and braces and different shots, and despite that, his pain and process is getting a lot worse in there. It's severely affecting his daily activities, and it also keeps him awake at night. And for this reason, we felt he'd be a good candidate for a knee replacement and a good candidate to be done as an outpatient.
You know, before we started doing this, it always seemed like a very scary experience to a lot of people, and they were really told that, hey, this is going to be a tough recovery. And while it still is a big surgery, I think we're showing people more and more that they can really get moving after this and really get back to their active lifestyles quicker than probably what they had previously thought they could do.
Joint replacement surgeries with hips and knees and for shoulders, for that matter, are very, very safe operations nowadays. They're big operations, and they can't be said that they're not. They are big operations, but our techniques nowadays are very, very good. Our surgeries with the minimally invasive techniques really minimize risks around the time of surgery, minimize blood loss. We're able to get people up walking right away. A lot of people after surgery tell us the post-surgical pain is much less than it was before surgery, and they're very, very happy afterwards. The biggest complaint we get from people afterwards is, why do they wait so long? Because it basically gets your lifestyle back to normal, where it hasn't been that way in years and years.
Long gone are the days where we used to have people sit in bed for a couple of days or even weeks before we got them up and moving. So patients get up right away when they're in the recovery room at the surgery center with the surgery center staff. And then typically as soon as they get to therapy with us, we have them up moving around. Getting up and walking is probably the biggest part of the recovery process. And we really encourage them to be up multiple times throughout the day, getting around and walking. We really encourage these patients to not just rely on their loved ones for help at home, but that they need to start being independent right away from the start. Ed did great right from the start. You know, that first day of surgery, I mean, he was ready to go, he was excited, he was feeling good, and he really just jumped right out of the wheelchair when he got there, and you know, we were able to push him through all of his walking and his exercise with no problems. I think with Ed too, he really showed the positive attitude can make a big difference, and I mean, when we put him in the car to leave, he was smiling and waving, and he was really feeling upbeat and good about this stuff. So I think he's a great example of, you know, how successful this procedure can be as an outpatient surgery.
The care that I received from start to finish was just incredible, and the expectation I had about being able to put my foot down, being back at the gym 8 weeks later, far exceeded any expectations. The key for me was to get back with my kids. I really feel I have my life back. I'm going up and down the stairs without pain. I'm getting back on the treadmill. I'm walking flat-footed again, which I haven't done in 2 years. And it was the best decision for me, with the help of my surgical team, my doctors, my physicians, and the care that I received through PCI and the Surgery Center.